The world-renowned Wills Eye Institute, located in Philadelphia, Pennsylvania, has been serving the community since 1832. As the Institute continues to train ophthalmic surgeons with the latest surgical tools, there was a need to upgrade their old video systems. The Wills team was looking for a high-quality, robust system that was easy to use. They ultimately chose Sony's HVO-1000MD recorder and the PMW-10MD HD camera system, both meeting and exceeding their expectations. Today, we bring you 3 different perspectives from the professionals at Wills Eye Institute. You will learn how Sony is helping them to continue their excellence in surgical training.
The idea of training physicians just in ophthalmology started at Wills a few years after we opened our doors. So we've trained the most ophthalmologists in the world, and we have the largest alumni network. Well, we were upgrading our operating rooms in general, and we were always trying to stay at the cutting edge and at the very forefront of innovations in medicine. And we were particularly looking to improve our videotaping capability. And we became aware of this Sony System and its multiple capabilities and its ease of operation. And the company has a great name, and the price was right, and it's been win-win for us on all those fronts.
The MPEG-2 system that we were using was perfect 10 years ago. Most of our doctors were PC-based, but as the years moved on, they were Mac-based. And the MPEG-2 system, we had to kind of use a workaround in order for us to teach the doctors how to use it in their Apple systems. So the recording system from Sony is an MPEG-4 recorder. So it was perfect for our doctors today. The Sony system has definitely improved our workflow. We have a small technical staff that we have to teach the doctors a manageable workflow for them. And the Sony system allows us to kind of lead the horse to water and teach them to drink. I can't be there with them, my staff can't be with them 24 hours, 7 days a week. And the Sony system allows us to easily teach them, and they can take what we've taught them and create their own workflow.
Oh, it clearly has made a big difference, both in terms of day-to-day work and also preparation for conferences and review of teaching cases and other aspects that are very integral to a busy teaching academic center such as Wills. I think from the faculty standpoint, many of us are using the videos when we go to conferences and for continuing medical education purposes. From the resident standpoint, we're using it as a training device and having the ability to record either in regular definition, standard definition, or high definition makes a big difference in terms of being able to manipulate the files for some of those training cases too.
It's very easy to record to the HV-1000. I typically have a portable hard drive that I plug directly into the USB port, and it's a plug and play. And then I can just very easily have it set up in under 30 seconds with the file labeled. So I record directly to my hard drive. And then when I'm done my case, the nurse just presses stop, and if I have to leave, I just take it with me. And I can easily just view the video on there or download it to my laptop to edit the video. You can also store to the hard drive, which is quite large and has been nice for times when we've forgotten to have our own personal hard drives with us, and we can quickly go back in the archive and pull files as necessary. One thing that's nice about the HV-1000 is that it's not a barrier to patient care. So when we're trying to transition quickly between cases or from the clinic to the OR, it only takes me about 30 seconds to enter in the information and get everything up and running. And there's been times in the past where I know that residents have wished they've captured a moment but didn't because the older video system was more difficult to set up. So I think that's very advantageous that we're always able to capture the moments that we may not have anticipated.
There were a number of features that were appealing. The high definition plus standard definition formats were appealing. The ease of editing was appealing. The price point was appealing, and of course the reputation of the company that stood behind it.
Twice a month, our residents present their surgical cases to an attending in the auditorium. The ease of use of the Sony system means that it's perfect for resident fellow education in the OR and out of the OR. The resident can take a recorded case on their hard drive and plug it right into the computer in the auditorium and present their surgical cases to one of our attendings for review.
It's absolutely crucial that we have very high quality video capability, both in the operating room and then for review afterwards.
The HVO-1000 has been very helpful in helping me develop my surgical skills because it allows us to be able to easily review our surgeries both at home and in conferences with our colleagues to improve our skills. It's very easy to hop down from clinic to the OR and get right into operating with very minimal setup time and transfer your recorded material to your device very easily. It's also very good video quality, which allows us to see some of the finer points that in the past were lost.
Our residents do a surgical rotation. And the great part about the HVO-1000 is not only is it a great HD system, it's also a great SD system. Because when our residents start their surgical rotation, they have longer cases. It takes them a little bit longer to get through their cases. So I instruct them to record in SD at those times. And as they move on in their surgical rotation, they become more skilled surgeons and they're able to record in HD.
Yes, I would recommend it. We've been very happy with the system, and it's been very amenable to the multiple needs that we have for video capture and editing.
This is an easy system to recommend to anyone. Here at Wills Eye Institute, with the amount of doctors that use our systems every day, we have doctors that have different technical abilities when it comes to recording and editing videos. And we are able to create a manageable workflow for each of those doctors.